Here's how to help someone with a porn addiction. Begin by knowing the signs of a porn addiction. The field manual for much of the psychology industry is the Diagnostic Statistical Manual of Mental Health, which is currently in its 5th edition. The DSM-5, while there is not an official diagnosis for pornography addiction as of yet, many industry professionals agree that the criterion for hypersexual disorder fits the mold. Pornography addiction includes overwhelming recurring urges, behaviors, and fantasies that result in severe psychological impairment. The behavior must have led to impairment or distress within the affected work or social life to be considered an addiction. The person in question must have tried to quit without success, and the symptoms must have existed for at least 6 months. Another one of the signs of porn addiction is a disregard for emotional or physical harm to oneself or others. An official diagnosis would need to be done by a healthcare professional, but knowing the symptoms can help decide if that's a step that needs to be taken. Can you even help someone with a porn addiction? Pornography addiction is like a process or substance addiction. If a person's not ready to quit, there is little that even the closest friend or relative can say to get them to do so. You can, and should, offer non-judgmental support and an open mind. People who are genuinely addicted already believe that what they are doing is not suitable for them and have thought about quitting, tried to quit, and ultimately failed. They don't need to be told what they're doing is bad and that they should quit. Once you're sure that it is an addiction, and you've learned what good support is, it's time to learn how to help someone with a porn addiction. How to help someone with a porn addiction through empathy. Listen empathetically. Be an asset, rather than a liability. If you really want to help, listen. Put yourself in their shoes and try to really feel what it would be like to want to stop, tell yourself to stop, and ultimately fail to do so. Try to understand what it would be like to sincerely struggle to control your own actions. Let any one of you who is without sin be the first to throw a stone, John 8 verse 7. If you're honest, you can remember a time when you did something you wish you hadn't done. You can remember when you let someone down in your life. What a person struggling with addiction needs is loving support. Then when they're ready for help, they'll come to you as a trusted resource, and you'll know just what to do. Believers with strong faith can always turn to Scripture. As we mentioned earlier, a sort of chemical addiction occurs with repeated pornography use. The brain releases dopamine, which is a reward to the senses. Repeated exposure in excess can lead to feelings of withdrawal. A person can get to the point where they don't feel right without that chemical release. 2 of the most relied upon resources for addiction are Alcoholics Anonymous and Narcotics Anonymous. The fact that both support groups have religious underpinnings is not a coincidence. There is power in Scripture for those who believe. When all else fails, a licensed counselor can be a valuable resource, and as long as you're not a physical threat to yourself or others, what you say to your counselor is strictly confidential. They can't and won't share this information with anybody. Counselors can get to the root cause of the addiction, and they can rule out possible secondary causes. While the addiction can be nothing more than a craving for more dopamine, it can also be covering up underlying or unresolved past issues or trauma. For some, it may not be possible to fully kick the habit until these underlying issues are resolved. When it comes to processing addictions without underlying causes, a psychiatrist can potentially simplify and streamline the process of quitting. While the concept of pornography addiction is still relatively new, there have been some valuable discoveries lately. One study found that a lower dose of naltrexone, a prescription used to help people quit smoking, also offers modest amounts of support to those battling a porn addiction. A psychiatrist can also run tests and assessments to determine if a hormonal imbalance could be to blame. In other cases, people turn to porn to escape their depression. When hormones are imbalanced or depression is involved, a psychiatrist can offer mood stabilizers and antidepressants to help kick the habit. Our brains release dopamine when we eat good food, make new friends, or engage in horizontal refreshments. Hit like and subscribe if you know what we're talking about. After experiencing a pleasureful hit of dopamine, the body wants more. This drive for more dopamine has led to laboratory mice choosing cocaine over food to the point of starvation. Of course, people aren't mice. We have a prefrontal cortex and morals that should hold us to a higher standard. but again, who hasn't had cake after a meal? We didn't need it. It was the pull of dopamine. After repeated slips, the increased dopamine becomes the new normal, and users start to feel even worse when they don't have it. If you know anyone who's struggled with addiction, then you should be seeing the incredible similarities between the different types of addictions. Pornography offers a quick, easy, and free hit of dopamine. For someone who is depressed or wasn't blessed with good looks, it can seem like a solution to an unfair situation. None of this changes the fact that the creation of porn hurts people spiritually and, in many cases, physically. Repeated use can lead to addiction. Then, just like with other addictions, when you try to remove the stimulus, you feel even worse. Fortunately, help is available. Friends can offer empathy and non-judgmental support. Counselors can help addicts find root causes and choose healthier alternatives, and psychiatrists can offer prescriptions that can make quitting a little easier.